When students apply to study at the University of Sunderland, they get a choice of trusts that they wish to express an interest in doing their placements in, and Newcastle Hospitals is one of them. And then they're interviewed alongside the academic staff with clinical staff here from Newcastle Hospitals. When students come to interview, the best thing for them to do is to have a little look about what issues are current in nursing, and they also need to have a little think about what they might have done in their personal life that ties in with nursing a little bit, so demonstrations of empathy or going the extra mile, things like that always come across really well at interview.
So I chose Newcastle upon Tyne Trust Hospitals because of the major trauma status and the wide variety of specialised areas that I could go into. My best moments would have been all the different procedures, being one-on-one with patient care and being involved in the teams that I've been placed in through my clinical placements.
So my role within the Trust is to support students whilst they're on placement. I'm very privileged to be able to look after our students here at Newcastle Hospitals, and as a student who studied here myself, I realise what a fantastic opportunity it is, but how challenging it is as well. So I'm here to provide support for all of the University of Sunderland students who come through here.
Support's been absolutely brilliant. We've got support from our PPFs, we're mentors from university, and a lot of the nurses are very supportive. The specialities as well, they're happy to have you with them and supporting. Definitely go and research your placement, go and introduce yourself and just be yourself when you go on placement. If there isn't anything you can't do, just ask, because everyone's willing to help.
Because I've had a variety of different placements, there's been loads of different things that I've enjoyed. I've enjoyed working in hospitals on wards. I've enjoyed community placements. I've done quite a few community placements. I've done a different range of placements as well. Like I've done mental health placements as well as just normally being on the ward. I think a lot of people think that for nursing that you are based in the wards a lot, but nursing's a lot more than that, and you know, you're in the communities, going to people's homes.
Students do a wide variety of placements throughout their 3 years training here. They get to experience the medical wards, the surgical wards, they get to experience the specialist areas that we have as well. Placements are usually around about 8 weeks long. We do send the students out into the community as well, so they get to see a little bit of everything that Newcastle Hospitals has to offer. One of the great benefits of coming to Newcastle Hospitals is that they'll get to see so many different things and so many specialised things as well. We have an Institute of Transplantation, which is very exciting. We have our Northern Centre for Cancer Care. We also have a major trauma unit.
It was a bit scary at first because going into a theatre for the first time, you don't really know what to expect. But being part of that and part of that process, because I knew the patient beforehand and followed them through the whole journey that they were going through, and the aftercare of when they had the surgery and after the surgery. It was phenomenal to be a part of that and to get them home and back to their family. So you can actually put practice into theory. So originally we started a lot of theory work, and for people like myself, I had never worked in care before. So I felt like a bit of a rookie because I was working with people who had been carers for years or healthcare assistants, and they had some experience whereas I didn't. So a lot of people were reflecting back from experiences that they've had, and I'd never had that. So when I came back from my placement and learned all of these new skills and done all of these new things, when I actually came back, I could relate and I could understand, and then I can say, okay, I understand why we had that lecture, why we're talking about this. And if you do a simulation and stuff, it's not the same as when you're actually working with a patient who actually have feelings and emotions, and you know, every day is different.
If you're ambitious and you see your career going far, this would definitely be the right place for you to come.